This is Dr. Ben White with the Rational Wellness Podcast, bringing you the cutting edge information on health and nutrition from the latest scientific research and by interviewing the top experts in the field. Please subscribe to the Rational Wellness Podcast on iTunes and YouTube, and sign up for my free ebook on my website by going to drwhites.com. Let's get started on your road to better health. Hello, Rational Wellness Podcasters. Thank you so much for joining me again today. And for those of you who enjoy listening to the Rational Wellness Podcast, please go to iTunes and give us a ratings and review. That'll push us up in the ranks and more people will find out about the Rational Wellness Podcast. Our special guest today is Dr. Al Danenberg. He's a periodontist and a certified functional medicine practitioner and a certified primal health coach, and the author of Crazy Good Living, Healthy Gums, Healthy Gut, Healthy Life. But today, we'll be speaking with Dr. Al Danenberg about his own health and his battle with a form of bone marrow cancer known as IgA kappa light chain multiple myeloma. Multiple myeloma is a relatively uncommon cancer of the plasma cells in the bone marrow. Traditional treatment for active myeloma typically involves a combination of chemotherapy drugs. A stem cell transplant is sometimes done following the chemo with stem cells from a donor. Bisphosphonates may be given to stimulate healing of the damaged bones, and radiation may be offered to treat specific areas of bone pain. Dr. Danenberg has chosen to forego traditional chemo therapy and has decided to take a natural integrative approach. I'd like to give listeners one more piece of information that is going to inform the discussion that we will have, which is that Dr. Danenberg has chosen to be very public about his own healthcare situation. And he's been publishing a series of blog posts where he's been very openly and talking about his situation and very courageously facing down a terminal illness. And I appreciate you talking about your situation, Dr. Danenberg, because I think it's a great glimpse into the human condition, and I think it could be very informative and instructful for other patients out there. Al, thank you so much for joining me today.
Hey, Ben, thank you. This is quite an exciting experience. As you know, you and I have had a conversation before about mundane things like gum disease and gut bacteria and all that great stuff.
Yes.
And now we're talking about a little higher level of a challenge that I'm actually personally experiencing.
Why don't you tell us what were your first symptoms of your cancer and when did you first find out about your diagnosis?
Sure. So most people who know me, and if you don't, I'm 71 years old, and I have been in practice for 44 years practicing periodontics. Didn't start off as a really healthy guy, but about 6 years ago, I became primal in my nutrition and lifestyle and became amazingly healthy. I've dropped 30 some pounds from when I started at the age of 66 through last year. I completely eliminated all medications that were prescribed to me from previous issues that I had. And basically, I was a healthy guy. So I was doing and I speak around the country. So I was doing a seminar at a dental group somewhere, and I was progressing to one of the airports in Atlanta, which is a very large airport, as you may know if you have gone. And when I do that, if I have time between flights, I don't take the train, I walk the concourses. And so if you know Atlanta Airport from A to E concourse or F concourse, it's a long walk. So I had a very heavy bag on my shoulder. This is April last year, 2018. And I just carried that from one flight to the other flight. And I started to develop, by the time I got to my connecting flight, some soreness on my shoulder. And I thought, well, maybe I pulled a ligament and did something stupid and it would go away like any muscle pain would go away. So the next day it was still sore. Did my thing, got back to Charleston. It was sore on the right of my shoulder, and then it started to go away to some extent, went into my back area. And then a few weeks later, it kind of went away from my back area, went into my chest area, and it was starting to get really painful. And I thought, this is not a normal muscle issue. So I went to my physician in Charleston around September or so of 2018. And he looked at me and pressed around my rib cage, which was very, very tender. And he said, let's do some blood work. So he took some blood, did the conventional type of blood work. Everything was pretty normal, and I see him every year. So it's basically the way it had been, except my CRP, this C-reactive protein, was elevated. Generally, my CRP was usually less than 0.5, very healthy, no chronic inflammation. And it was something like 3.5, 4.0. To me, that was an alarm bell. And so he said, I don't know what's going on. Let's do an MRI. So we do an MRI, and he calls me up and says, Al, and he's known me for 30 plus years. He says, Al, do you want to come into the office and we'll discuss it, or just talk about it on the phone? I said, great, let's talk about it on the phone. He said, if I were you, I'd be very concerned. And he said, my initial differential diagnosis is either I think you have lymphoma, leukemia, or multiple myeloma.
Wow.
None of the three doors were the doors that I wanted to open.
Right.
So he said, in addition to that, I see a mass, a soft tissue mass on the side of your spine. And I also see 2 broken ribs, a cracked vertebra, and a cracked pelvis. What happened? Did you get beaten up? Did you fall down some steps? What happened? I said, I don't know. I mean, I only was carrying this bag, and it got sore, and it stayed sore. So he called in an oncologist. We did a CT scan, a PET scan, a tissue biopsy of the mass on the side of my spine, a whole bunch of more detailed blood work. And September 19th, 2018, I was diagnosed with IgA kappa light chain multiple myeloma, which is very aggressive. And the radiologist who read the CT scan said in his report there were innumerable lytic lesions throughout the entire spine. That means holes everywhere. And that's the reason why I had cracked ribs and vertebra and pelvis, because it's almost like severe osteoporosis. Something's happening and the bone is dissolving away. And what's happening is the malignant plasma cells are setting up a cytokine reaction, and IL-6, I believe, is basically destroying the bone. Well, he said to me, and my family came in at that appointment, so they were all there, and he said to me, based on what I see today, and that is in September 2018, I'm going to recommend what I think you should do, but if you don't do anything, I predict that you have 3 to 6 months to live. Now, here's a healthy guy. At least I thought I was healthy until now. And I am sidestruck with this diagnosis that is truly life-threatening. What would you do? So, you know, I thought a little bit about it. We're sitting there, and I'm telling my doc's name is George, and I said, what do you recommend? He said, immediately, I would recommend we start on a cocktail of chemotherapy drugs, and then maybe IV bisphosphonates to strengthen the bone. And because I had such severe external pain from the loss of the bone in that area, do some radiation and see what's going on. And he said, but you have to understand, this is not a curable disease. And I asked him to explain that, and he basically said what generally happens. You go through chemotherapy, you get remission because you're killing all these plasma cells, and in addition, which he didn't obviously tell me so much, and that is we're killing everything in the immune system and everything else in your body. And then you'll do fine for a little while. And then the multiple myeloma, the malignant plasma cells are going to retake itself, and we'll have to use a different chemotherapy cocktail because it will not respond to the original chemotherapy, so it needs to be more aggressive. And then maybe even stem cells, either we get them from you that we can cultivate, or we have to get it from a donor, and maybe that will work, but stem cell therapy, because of what I have, isn't so successful. And then, eventually I will die from the complications of multiple myeloma. And I said, well, wait a minute, you're telling me I'm going to die from this disease, and it's going to be in stages, and every time it exacerbates, it's going to be even more caustic for me to get treatment, and I'm still going to die from this condition. Why do that? Why put myself through the tremendous decrease in quality of life and dignity of life, and not to mention the practical side? First of all, my family would have to deal with this dread for an extended period of time until I die. And then financially, and let's be realistic here, a lot of these drugs are not covered by medical insurance. And some of them that are just in the investigative stage, if you're not in a clinical trial, definitely is not covered by medical insurance. So I could die, and my wife could be left with a $500,000 medical bill. And then she'll have to deal with that. It makes no sense to me. And it made no sense to me to treat my disease by killing everything else in it. So I decided what I need to do is get rid of the pain in my sternum, which is the immediate radiation treatment for 10 days. That was successful. And I investigated an integrative alternative plan, which I'm doing now. And by the way, it's more than 6 months. I am still alive, and I feel fantastic. And my doctor says, wait a minute, maybe I made a misdiagnosis. I said, no, you didn't make a misdiagnosis. Maybe my alternative therapy is starting to work. Now, I don't know that that's going to happen, and I don't know that I'm not going to die next week, next month, or 5 years from now. But I have taken a course that is keeping me alive in a way that creates quality of life. I feel great. The little things that are bothering me we can talk about, but basically I feel great, and I'm grateful for that.
So tell us about your natural plan that you're
Sure.
using to help your body fight off and heal from this cancer.
Sure. So as you know, diet is everything. And maybe I should go back and first kind of give you an idea why I think I contracted this, because I have some people that read my stuff and they kind of blurted back to me and said, well, everything you were doing that you thought was so healthy, doc, obviously didn't work, doc. And I'm saying, oh my God, this is ignorance, but I need to address this. When I was in dental school, and that was a long time ago, 45 plus years ago, I was in undergraduate dental school 4 years, and then specialty school for periodontal training for 2 years. So 6 consecutive years. In the dental clinics, there were x-ray machines everywhere. And we learned how to take x-rays on people and whatever. And in those days, I don't know how well the x-ray was collimated. I certainly don't remember wearing all the protective clothing that maybe I should have. So I am assuming that I was exposed to excess ionizing radiation, dental x-rays, over the course of 6 years on a pretty regular basis. Well, one of the actual causes that has been known for multiple myeloma is ionizing radiation, dental x-rays. As a matter of fact, there was a study that was done some years back that showed that dentists, male dentists in my age group, have a higher incidence of developing multiple myeloma than the general public. Very interesting. Very interesting. And I had to dig for that research. So I'm thinking that is a possibility. All you have to have is one malignant cell, and then you have a malignancy, because that cell doesn't die naturally, keeps growing, and it can replace other healthier cells.
By the way, I noticed when I'm at my dentist's office, There's no lead-lined walls. There's not even a complete wall separating one room from the other. There's just these thin walls, sometimes, with little windows. And so it doesn't seem like the x-ray machines in dental offices that there's really a proper shielding. Is there supposed to be?
Today, there is shielding in the walls, theoretically. I don't think that you can even build a dental office and get it approved by, the people to be that tell you everything is okay and you can start seeing patients. But without these lead shields built into the walls or the x-rays behind some type of a lead device. And it's a scary thing. I mean, the amount of radiation that you can get just yourself in a dental office is not that much. But if you're there all the time,
Sure.
forever and ever, 6 consecutive years, I'm going to tell you, I had a lot more radiation than you ever had in your life.
Of course.
But you need to ask some questions when you go to doctors. I mean, if you had CT scans all the time, you are bombarded with a lot of ionizing radiation. I've refused to do more CT scans, for example, at this point, because I'm not interested in exacerbating what's already there.
Or getting a secondary cancer somewhere else.
Exactly. So unless it was critical for that type of biomarker or x-ray picture, it's not going to do my health any good. And the other thing, though, in dental...
And instead, you're opting for MRIs. Is that right?
Correct. So I am doing my next MRI at the end of this month, and we'll see where we are. It's not completely telling, but it'll tell a lot, and that's all I need. See if I'm progressing in a positive way. The other thing is, and this will amaze you, dentists have been, and even still are trained in many dental schools, to put in mercury fillings. Oh my God, I can't believe that, but it is true. And in those days, here's how we did this. It'll blow your head away. We took the liquid mercury, which is a beautiful thing, in a little jar, silvery, liquidy mercury, and dropped it into a little dish and mixed it with some powder to make what's called the amalgam. Now you have this silvery, mushy mess, and it has a lot of mercury. So you put it in a little piece of cotton, like a cotton square, squeeze the excess mercury out of it, and we're talking about with hands, squeeze it, and throw the excess mercury on the floor, on the clinical floor of the dental school.
What?
Everybody did it.
Wow.
45 years ago. Everybody did it. And I am sure that the entire dental school was toxic because this mercury vaporizes quickly and it's everywhere. So the excess mercury and the ionizing radiation on a continuous basis possibly created what went on in my bodies. But with me being as healthy as I have been, my oncologist, who's a conventional but fantastic oncologist, explained to me probably my lifestyle and diet kept everything under control, and it didn't manifest until it just got out of control. And that's why I developed multiple myeloma. So how am I treating it? One of the things, of course, is a healthy, clean diet. And I don't want anything that's going to interfere with my ability to have an enhanced immune system that I can. So I am eating basically a paleo-type autoimmune diet, less carbs than normal, but not strictly keto. And I do intermittent fasting. I don't do multi-day fasting, although I had done that every now and then, but I definitely do intermittent fasting. So my last eating meal is literally ending by 8 p.m. one night, and then I won't have anything to eat until maybe 1, even 2 p.m. the next day. So I have just a small window of eating. I basically am a fat burner. I have no problems with hunger. It's just not a problem. But you have to develop to get to that point. You just can't say, I'm going to do intermittent fasting, have a piece of cheesecake last night, and then all of a sudden not eat until 2 p.m. and not feel hunger pains. So, you have to get into that state. So I'm doing that, and I think that's a critical factor. Another factor that I'm doing is...
Are you having any trouble keeping your weight up by doing the fasting?
No, because I do eat things like sweet potatoes. So I get the starchy tubers that take care of my diet and my calories. I am not exercising like I used to because I just physically can't. I do have some pain and I have a lot of tiredness. So I know that I could have a problem. Generally, cancer patients lose weight, but a lot of that is because of chemotherapy, not necessarily the cancer cells are just digesting all this food so fast. So my diet is critical. I'm working with an integrative physician, not in my town, but in another town. And he and I have conversations on basically every 3 weeks to tweak different supplements. So I take a variety of supplements, which I've never taken before, but I take these supplements to support my bone metabolism, to support my immune system, help me with antimicrobials that he feels are necessary, certainly good digestion. I take a number of things to really improve my gut microbiome, spore-based probiotics, basically because they actually do germinate in the gut. They're not killed by acids.
Would you mind going into your whole detailed supplement program?
Actually, it has been like 30 supplements 5 times a day. It's kind of crazy. I could send it to you for your perusal.
Would you want to go into some of the highlights?
Yeah. So let me tell you what I think is really core. Okay. There is a product called Salvestrol. Salvestrol is a product from well-ripened fruits, and it is especially the berries, and it is loaded with the phytonutrients. And what that Salvestrol does, which is unique, is that it gets into the blood system, and it is attracted to certain enzymes that are dominant in cancer and precancer cells. And these enzymes are part of the cytochrome P450 process of creating digestion and detoxification in the body naturally. And these enzymes are called CYP1B1 enzymes. They, like I said, are highly concentrated in precancer and cancer cells. Very little is in, or none is in, normal cells. So these enzymes attach or bind in some way to the salvestrols. The salvestrols and the enzymes react, and metabolites are created that literally kill the cell. So if these salvestrols were attacked by enzymes in normal cells, it would kill normal cells. But these enzymes are not in normal cells. They're just produced by the cancer cells, interestingly enough. And there could be some rationale for the reason why it's there. And these are natural occurring phytonutrients. So I do take quite a bit of this. There is some great peer-reviewed research about salvestrols. There are a variety of sources of salvestrol I get from Canada. I know Europe has plenty. There is ongoing research, and I think that this is a major factor. There is another product from a brown seaweed called fucoidan, Fucoidan. Fucoidans have some other interesting properties. They do help cancer cells with apoptosis or self-death, but it may be along the lines that it actually is improving the mitochondria of the cancer cells, because cancer, for some researchers, is basically a result of mitochondrial dysfunction. Every cancer cell has mitochondrial dysfunction, but all chronic disease has mitochondrial dysfunction. But if there are cancer cells that have mitochondrial dysfunction, and you can repair the mitochondria, you can help these cells maybe create self-death and or prevent them from becoming cancer cells. So fucoidan has the benefit of helping the mitochondria and helping kill cancer cells. So I do take this brown seaweed in a very concentrated state. Those are the two things. And then a lot of general supplements to repair or help bone metabolism. I get a few products from MetaHerb and
Standard Process.
Standard Process, thank you, my memory is going away. Standard Process, and then a few other types of supplements that are going to help with digestion and antimicrobial.
I noticed you include curcumin in your
Yes, curcumin, definitely. And there's a lot of great research about curcumin in cancer cells, so I'm doing certainly curcumin. There's a MetaHerb product that I use, but there are a variety of products. As long as you get a biologically active curcumin, that's great. It's not generally bioactive because it has to get absorbed properly, so you have to have a vehicle that's going to get absorbed properly.
Are you monitoring any lab tests to go along with your supplement program to see if the interventions are,
Yeah, so the lab tests are very specific for multiple myeloma, and I get that every month. Originally, now I'm only on every 2 months because my doc says, things are more stable. But
right.
there are some tests that will determine the degree of the malignant antibodies that are floating around, and the ratios of these malignant antibodies are critical. Right now, I'm still way, way, way high, but it's not as bad as it used to be. So yes, I do monitor that. Now, let me tell you another thing that is, in my mind, a very critical element to what I'm doing. And that is, I just touched upon it, and that is mitochondrial dysfunction in cancer cells. So the mitochondria needs repair, and there is a process that actually can repair mitochondria. So let me just mention that one of the destroyers, there are a lot of destroyers of mitochondria, a lot of prescription drugs, certain foods that we're eating, the chemicals that are on foods, but dirty electromagnetic fields that are generated between you and me right now because of what we're doing are damaging the mitochondria. What they're really doing is breaking down the calcium channel passages between cells, and it's also breaking down the protein complexes within the mitochondria that create ATP. And ATP, as you know, is the energy of the cell. If that energy is not there, the cell weakens and eventually dies, theoretically. So what I am doing is using a therapeutic process called pulsed electromagnetic field therapy to help repair the mitochondria in my body. And I don't think there's any way to be specific to the mitochondrial repair, and I don't care. I just want my mitochondria to get repaired as best as possible. So I lay on a mat from a company that we can talk about later if you want, but it is a flexible mat, feels like a very thin, soft, pliable yoga mat. And it lays underneath my bed cover. And we have timers that can go on and off on the mat. And during the day, I can lay on it, and I do it 3 times a day. And there are different settings. And the company that I work with has settings for cancer, as well as many other things. So I use this mat to help stimulate the mitochondria to repair, as well as to improve the calcium channeling within the mitochondria. And I believe that this is repairing my body. Now, I do know from reading research, not my personal research, but I do know that NASA has used this type of therapy to help astronauts to prevent osteoporosis, because they learned that astronauts being in space for a period of time develop osteoporosis for a variety of reasons, and pulse electromagnetic field therapy can prevent and cure that kind of problem. So I'm using this mat that I do 3 times a day, and I think that is a real critical element to my overall protocol to treat my cancer.
Awesome. Awesome. Are you able to exercise right now?
I'm starting to try that, and actually I got a good bit sore, so I have to come back. I'm doing, Zach Bush has a 4-minute video, or a 4-minute exercise video on YouTube. Easy to Google, Zach Bush 4-minute video. It is a great exercise program. It helps to stimulate and release nitric oxide. He's a cool guy anyhow, brilliant physician. It's got lots of degrees behind his name. And it's very non-invasive for me. It's not particularly damaging to my body, and I've tried to use that. I used to use that on a regular basis, as well as other types of exercise, but this, I think, is the kind of exercise I want to get started with before I move on. My son actually owns a couple clinics, one in Charlotte and one in Greenville, Charlotte, North Carolina, and one in Greenville, South Carolina, where he works with patients and athletes and does quite a number of therapeutic exercise programs, and he's going to help me with that. His company is called Performance Therapy, and he's really astute in this exercise program. So he's going to help me develop a more gentle, progressive exercise program as soon as I feel like I can get started.
Cool. Maybe swimming might be something you want to.
Swimming would probably be good. It's not convenient for me. Walking is not a problem, although walking a distance, I used to walk about 5 miles a day. Right now, that much walking really puts a lot of pressure on my spine and basically my pelvis, and that's where I have these fractures. So I got to be careful. Right.
And tell us about your latest report when you saw your oncologist.
Yeah, so it's kind of funny. So I'm seeing, I guess maybe it's been 3 weeks ago or something like that. I see my oncologist and he's doing his examination, and I'm really feeling quite good. And we just did some blood work, and most of the results were relatively stable, not progressing in a bad way. And one of the ratios of these unhealthy antibodies has actually significantly dropped, which is great. Still on a very high level. Certainly I'm not cured from this disease, but it had dropped. And he said to me, possibly, maybe I made a misdiagnosis. Maybe you have not this aggressive form of multiple myeloma, maybe it's indolent multiple myeloma. He wasn't really joking at first, and then he started to laugh with me, and I said, just give my alternative protocol the respect it deserves. Maybe what I'm doing is helping me. It's just that you've never seen this before. And, you know, he's a traditional, conventional oncologist with a big group working in a major cancer center. So if he were to tell any of his patients to do what I'm doing, he probably would be kicked out of his group and maybe sued because of malpractice. He's not following the norm of treating cancer. So I understand that, but he is interested enough in what I'm doing that he requests me to send the medical papers that I'm reading that are supporting and giving me thought as to what I want to integrate with my protocol.
Now, how are you supporting your bone health? Because
yeah, so
bone marrow cancer, it leads to
yes,
damage to bones, and you mentioned that you have several fractures.
2 of the products that I get from Standard Process are Bone Complex and Bios. So I think maybe Bone Complex is actually from MetaHerb, but MetaHerb is sold through Standard Process. I'm not sure if that's true or not. And Bios, those are 2 things that are supporting my bone metabolism. And I think that's the only specific that I'm taking. I definitely do take vitamin D3. I take gobs of vitamin K2, which is so critical.
How
But
much?
K2
How
is
much
very,
vitamin D and vitamin K?
K2. So right now I'm taking 5,000 international units of D3. And of course, the way you eat, mushrooms or egg yolks. I mean, you're getting vitamin D3 in certain things too, but I am taking an extra supplement of D3. I do take vitamin K2. I think I use megaquinone K2-7 from Microbiome Labs. It's 320 micrograms, which is quite a large number. But there's never been demonstrated any lethal dose to K2, and I think the more the merrier. And recent studies have shown that vitamin K2 actually helps repair and rescue damaged mitochondria, which is brilliant. Actually, this is an aside, but actually I'm doing a double-blind study to demonstrate that spore-based probiotics and a high dose of vitamin K2 taken orally changes the gut microbiome and eventually changes the oral microbiome to reduce gum disease and improve everything else that's going on in the mouth. And that is underway right now. It's been approved by the Institutional Review Board, and it's an exciting area.
That's amazing. Yeah. I think I heard about that.
Yeah, I think maybe we talked about it, but at that time we talked, it wasn't actually happening yet, but everything has gone through. To do these medical tests is, and those need to be approved, obviously, is a long, lengthy process. But once they get approved, they can start moving fast as long as you have the participants to do it.
And you mentioned supporting your gut health as part of your program.
Yes, yes.
Why is that important?
Well, certainly, our immune system is dependent upon the gut microbiome and the intestinal layer, which is only one cell layer thick. And if I have dysbiosis, I have chronic disease, period. And certainly cancer is a form of chronic disease. I need to get that gut as healthy as I can. I think it's been healthy, but I am doing that much more intensely right now. So I do take the spore-based probiotic. I do take vitamin K2. I use a variety of products that Microbiome has. And this is not really a commercial. I don't have any, other than Microbiome is funding this study that I'm doing, but they have nothing to do with the independent results. I think they're on the cutting edge of doing some products with lots of research based that is behind them to support not just the microbiome, which is a very important part, but the mucosal layer of the in the lumen, which is critical before they get anything happens to the actual epithelial layer of the intestine. So these are products that I take to support myself, and I think that's the core to chronic disease. I wrote a paper called The Big Bang Theory of Chronic Disease a year or so ago that was published in Wellbeing Journal. And I believe everything starts in the gut, but there's so many ways things damage the gut. It's just not the food, but so many things. Well, once that gut is damaged and the immune system is compromised and your host resistance is not where it should be, then other things start to manifest.
As a functional medicine practitioner, I fully in agreement with you that the gut is so crucial for the health of the entire body. I just saw a patient last week who first came to see me because she had seizures that were occurring every few months, and she wasn't able to, she lost her driver's license, and neurologist couldn't find anything. And then after talking to her for a while, she had all these gut symptoms that she had just considered normal because she had them for so long. And we did a stool panel and we looked at her gut, and her gut was really messed up. And we did some natural protocols to get her gut in order. And now she's 8 months seizure free, and she's getting her driver's license back just from fixing her gut.
And that's amazing. But what is not known by the general public is you don't have to have gut symptoms to have gut problems. Only 20% of people will have bloating and diarrhea and constipation and issues that are obvious. The other 80%, it's already systemic. It's already creating systemic inflammation and chronic in nature and disseminating to other parts of the body. And then there are the genetic weaknesses in other systems that are breaking down, not related to the gut as because of symptoms in the gut, but related to everything else that's damaged the gut that damages the rest of the body.
Have you done genetic testing on yourself?
No, and here's the reason why. I understand genetic testing is important for some thought processes. It may be important to give you a heads up as to, hey, you really need to be aware. It's almost like standing on the train tracks and you let the train slowly get closer to you. Eventually you should get off those train tracks, knowing what's really coming down. But if I were to know, let's say I had a SNP here or a SNP there or whatever genetic problems I had, I cannot change my genetic code. I cannot change my SNPs. I cannot do anything therapeutic within reason to do that. I do know that 80% or so of environment and lifestyle is going to either manifest a disease or not manifest a disease. That I have control over. You know, stress is a huge factor in health and disease. And if I were to put myself under stress, more stress, knowing all these things are inherently wrong with me, and what can I do to correct them, I'm going to really talk myself into more disease. There's some great papers that prove that placebo effects are not placebo effects, they're real. And that's because you have a positive attitude. Chris Krusher, who I totally recommend, he's brilliant.
Respect.
He just wrote a paper or an email that he sent to his people today, and it reviewed kind of a situation where somebody had all kinds of health issues and he was getting very, very ill. And he said, well, if I'm going to die, I'm going to be happy, and stopped worrying and started eating pizza and Coke or whatever it was, beer and pizza, and he got better. And obviously beer and pizza didn't get him better. He eliminated his stress. Chris is such a great writer. He brings across messages in such an easy to understand way. The point is, stress can be so much more damaging than anything else. If I had a healthy body but was totally stressed, I wouldn't have a healthy body.
Right. You make a great point, and Chris makes a great point, which is as much as we get caught up into these health promoting practices of healthy eating and everything else, we need to do it in a way that that also makes us happy. And if it becomes so much of an obsession that creates more stress in our body, then now it's becoming a negative thing.
You're absolutely correct. And again, I think this is part of the reason why I feel so good. I'm not going to tell you I look like I'm 30 years old and an Adonis, but I got to tell you, I feel extremely well, and I'll be 72 years old in a few weeks.
And how are you maintaining such a positive attitude?
Well, that's my point. I'm not sure why I've maintained this, except I've accepted it. I have a very strong spiritual sense, but I'm not religious whatsoever. But I have a spiritual sense. I believe in the soul. I believe where I am going to go. And we don't have to get into that conversation, but it is comforting to me to know that. And if this time around is the end for my life, I just want to make sure that the quality and the dignity are there until I drop dead. Mark Sisson talks about something like live long, then drop dead. I mean, basically, live the life you want to live and then just keel over, and not live a chronically diseased life with all kinds of ailments for 30 or 40 years and then drop dead. That's not the way I want it to be. And if I have any control, it makes my stress level much, much less. I stress. We all stress. But I have a great attitude, and I do feel like I am winning this battle more so than general medicine would have suggested. I've been told that I needed to sign up for hospice 3 months ago. So I'm not done that. So I'm okay. I'm good.
I applaud you, Al. I'm
Thank
with
you.
you. How can our listeners who don't have access to your blog get on the list and get a hold of it?
Oh, sure. Thanks. So they go to my website, which is drdanenberg.com, which is DRDANENBERG.com. Or go to my website, click on blogs. You can sign up for email alerts every time I write a post, which I just generally once a week. I talk about all kinds of things, but I certainly am talking about my journey. I've got maybe 15 or so posts as to when I was diagnosed and how I'm progressing and doing a variety of other things. So that's available. And if there's any comments, you can put them in, and there's a contact form. If you have questions, you can write a little email to me, and I certainly respond to emails.
Awesome, Al. Thank you so much for sharing with us and your positive force in the world.
You're kind. Thank you.